Hi, Mark Jamin here, Medical Director of the Haywood County Health Department, and let's talk about this pandemic. In this segment, what you should know about rapid point-of-care tests. You've probably heard about them. They've been in the news a lot lately. They're fast and cheap, but can they answer the question you want answered, namely, do I have COVID or not? Well, the answer is maybe, but only with certain conditions. And to understand this, I talked to the CDC, the FDA, and one of the companies. For you to grasp this, let's cover some terms. First, a false negative test result means you have the disease, but the test says you do not. This is referred to as sensitivity. And here's the risk. You think you're not infected, when in reality you are, and you inadvertently give the virus to others. A false positive test result means you do not have the disease, but the test says you do. The risk here is that you bear the burden of quarantine and worry when you needn't. Now, all tests have issues with false negatives and false positives. It's just the nature of tests. And it's true for COVID as well. So why is that? Well, it has to do with this curve. For any test to be able to detect the virus, there must be enough virus in the specimen. We've talked about viral load in previous segments. The amount of virus must be above a certain level for the test to be able to detect the virus at all. Something on the order of millions of viral copies in the collected specimen. So, an inadequately collected specimen may lead to a false negative. Or a person can be infected, but the sample is taken before there is enough virus present. Or taken after the immune system has knocked out enough virus that the level is again below the threshold. Any of these can lead to a false negative result. A false positive happens because the test picks up enough of something it confuses as virus. So the timing of the test, too early, too late, or just right, is critical to a reliable result. A person with symptoms of COVID should have millions of viral copies above the threshold. But in someone asymptomatic without symptoms, there's just no way to know. And here's why this matters. These point-of-care tests, or antigen tests, measure certain proteins in the virus, as opposed to the current standard test called PCR, or polymerase chain reaction, which measures genetic material in the virus. Now, processing a PCR test is quite involved, and with the increasing demand, turnaround times have really lengthened out from around 2 days out to 5 to 7 and sometimes even longer. The antigen test is fast. It uses technology like a pregnancy test for results in about 20 minutes. But the antigen tests have more false negatives and more false positives than the PCR. It's just not as reliable. And by the way, neither of these should be confused with antibody tests, something altogether different, and which still has no role in the diagnosis of acute infection. Now, recently, one manufacturer of antigen tests, Quidel, adjusted their process and have achieved a sensitivity that's similar or close to PCR. Now, no other antigen test companies have done that as of yet. In the process, the new specimen is placed directly in the analyzer. No transport solution is used. So if you want an antigen test to answer your question, there are some things you want to be sure of. Number one, ask which test is used. Make sure it's from Quidel, uses their Sophia platform, and that they are following the new process. If not, save your money. Number two, the FDA believes that a negative result in the Quidel test is reliable, but only in the first 5 days of symptoms, when presumably the viral load is enough to be above the threshold of detection. Pinning down exactly when symptoms began is critical. Otherwise, the result is not reliable. If you want to be extra sure, pay to have a second specimen gathered and test done. 2 negatives are pretty clearly a negative. Number 3, if you have symptoms and test positive, most likely you've got COVID. And if you're worried about a false positive and want to be extra sure, repeat the test. 2 positives pretty clearly eliminates a false positive. Number 4, the test is not recommended for asymptomatic people without a known exposure. There's just no way to know if a possible viral load is anywhere near the threshold needed. With someone asymptomatic but with a known exposure, it may be helpful. Number 5, certain asymptomatic groups may benefit from repeat testing, like nursing homes and jails. But how often to repeat has not been established. For people out and about with continued contact with possibly infected carriers, this strategy just does not work. So, antigen tests may have some usefulness. The results are back quick, but they are reliable only in certain situations. So be careful and be well, especially right now.